our job is hardcore.
There's all sorts that can happen.
Everything we do relies on this bond between us all.
Just slow down. No.
You're okay, you're okay.
You have to be comfortable in high-stress situations.
Save a life, and you're a hero.
You're in the hospital.
How much? Do you want to tell me what drugs you want and when?
Save 100, you're a nurse. In Australia, 1 in 10 nurses hails from the United Kingdom.
It's a bloody good job. It's so good.
Big deep breath in.
Through their eyes, you'll see life.
Push.
Good girl.
Death.
Unfortunately, we can't save her.
And everything in between.
Coughs, colds and sore holes.
Welcome to the front line
2, 3.
of one of the world's toughest
It's all right, darling. We're looking after you, okay?
and most trusted professions.
It was scary, hey?
Nurses are superheroes, without capes, just in scrubs.
There are high stakes in organ transplant. Our job as transplant coordinators is to give patients on death's door a second chance at life. It is an immense responsibility.
It's 3 a.m. and while Sydney sleeps, the day is just beginning for transplant nurse Holly.
I'm Holly and I'm one of the heart-lung transplant coordinators at St Vincent's Hospital in Sydney. It's a team of 7 of us nurses in the state, so it's a fairly niche role.
Holly has been called to the heart-lung clinic after an urgent appeal was made for donor lungs to save a young man's life.
When you put out a compassionate listing, we put it out to all the other states in Australia and New Zealand. It's to consider us and our patient that probably won't make it very long, more than a week.
An interstate hospital has answered the call. Donor lungs have become available.
The transplant that we're doing today is for a guy who's extremely unwell.
The 39-year-old patient suffers from an irreversible lung disease.
He's ended up intubated and on ECMO.
Extracorporeal membrane oxygenation, or ECMO, takes over the work of the heart and lungs. Without it, the patient could not survive.
Whichever part of nursing you're in, any time that you see a young person unwell, that's really hard to think about, you know, a life so short-lived.
The retrieval mission will take Holly and a team of surgeons on a flight across the country.
Okay, you ready? Have you leaving at 4 a.m. Be back by 8:30.
Time is of the essence with organ transplantation. Sometimes we go by road, sometimes we fly.
A 4 a.m. flight gives Holly just under 30 minutes to get everything prepared.
In terms of like gear, we've got checklists and checklists, and there's one person who checks it and there's another person who checks it. It's important that we just take everything with us.
It pays to check, as Holly has discovered, they're missing something essential.
I just need to grab one more bag from the theatre. It's something as simple as a plastic bag, but it's obviously what we package the organs up to bring them home in. So we even take it out. So. ICU. So it's the arrest alarm for ICU. So our theatre team go to arrests, as you can see behind me. But yeah, it's like a chilling alarm. I hate that alarm.
The cardiac surgeons that were about to embark on the organ retrieval with Holly have now been called to the intensive care unit to help the critical patient.
The patient that's arresting at the moment is our first priority. I guess fortunate timing that our surgeons are on site because we're about to head out. Unfortunately for me, that means that they're tied up.
Without surgeons, the organ retrieval will be delayed.
All right. Take 2. Get ourselves down to the ambulance bay and get ready to head out to the airport. Thanks. Thanks heaps. We'll load up the car with all the gear and then hopefully our surgeons aren't too far off. There are things that are completely out of our control.
But it's a setback that could cost Holly's patient his chance of getting the life-saving transplant today.
I mean, these are the things that you can't predict, right? We'll just hang tight. With the trajectory that he looks like he's on, yeah, it's a pretty dire-looking picture if he doesn't go on to get a lung transplant.
In emergency, there's no rest for the 13 nurses on shift tonight.
Wriggle your toes for us.
In emergency, you just never know what's going to come through that door.
1, 2, 3.
Well, we've got to be prepared for anything.
He has fallen about 3 metres off of a building site.
A second can be a difference between life or death.
Hello, emergency doctor speaking.
When the bat phone goes off, with me being the operational nurse manager, I go to the phone. I want to hear the story. I want to know what's coming in.
We are coming to you with a 63-year-old male bariatric patient. He's been complaining of approximately 5 days of abdominal pain on the right side, associated nausea and vomiting, and we'll see you in about 5 minutes.
And based on that 1-minute phone call, we have to assemble our team together. Things change from that phone call going off, so we always go worst-case scenario. We'll need everyone in to help with this. Wardsman to recess, please. Wardsman, thank you. So we've just got quite a large man coming in. He's a below-the-knee amputee. He weighs 166 kilos, bed-bound. Bariatric patients have increased health complications with heart disease and stroke and blood pressure, and so obviously a lot of risk there with him coming in.
So resuscitation nurse Yun is preparing for all possibilities.
We just want all the airway equipment to be ready, just in case things go south. Even though we got a little detail of what the patient's going to be like through the bat phone, sometimes when they come in, if you're not prepared for the situation, things can get really stressful.
Alright, so this is Bruce. He's 63 years old from a nursing home. He's been complaining of about 5 days of right side of abdominal pain.
Bruce needs to be moved onto a resuscitation bed using an inflatable mattress.
Just watch your backs.
Thanks, Bruce. 1, 2, 3.
That's it. Perfect. Pull that board out as it is.
Thank you, everyone.
You're right.
Oh, you're all right.
Before all the ambulance people leave, thank you very much.
You're very welcome, Bruce.
No?
So we'll get you sorted, all right?
With the patient safely moved, Nurse Yun must now work out what's causing his severe abdominal pain.
Do you want to point with your finger? Up there, okay.
I've got this leg amputated 12 months ago.
The skin feels a bit rough. Is that normally like that?
No.
No. It's hot as well. That looks like it's angry, so I'll let Ed know.
All right.
Yun has serious concerns about Bruce's amputated limb.
Ed, it looks like it's got some cellulitis on the amputation.
Okay, we're going to have a look at that.
Yeah.
Cellulitis is a dangerous bacterial infection of the skin. If left untreated, the infection can spread and become life-threatening.
Bruce, is it okay if I have a look at that leg of yours?
Yeah, I've meant to tell you, it feels a lot hotter than normal. But that just might be my imagination.
It's certainly warm.
It's very red and it's warm to touch. It's a clear indication that there's something wrong.
The infection on Bruce's skin might have already spread to his bloodstream.
You okay?
We're worried about signs of sepsis. Septicemia or sepsis is a bacteria in your blood that's spreading amongst your organs. It does cause organ failure. So I've collected bloods. It'll just tell us pretty much what his organs are doing and how sick he is. Sepsis is a very time-critical thing. You want to find the source of sepsis and treat it immediately, as soon as possible. It's potentially fatal.
In the early hours of the morning, an organ retrieval mission to save a young man's life has suddenly come to a standstill.
I see you. As you can see behind me.
Holly is meant to be flying interstate to get the donor lungs. But the retrieval surgeons have been called to the intensive care unit for an emergency.
It's a bit hard, like, with the surgeons not being here yet. Like, I mean, how long's a piece of string? I don't know if we're going to be an hour and a half behind or 2 hours behind. Yeah, it just gets all a bit tight.
Transplant nurse Holly has been waiting in the car park for close to 2 hours, and there's still no signs of the surgeons.
The coordination role definitely challenges me. I don't think anything would prepare you for transplant coordination. Feeling pretty cold, pretty tired. Oh, come on, boys. Patience is a virtue. Oh, thank God. Seeing the surgeon, seeing the whites of their eyes, I'm pretty relieved that we can get this show on the road. All right, 3 of us across the back.
The delay means it's now a race against the clock.
It's just the lung transplant. We are about 2 hours behind schedule. Charles and Wen had to pop a patient onto ECMO in ICU, so we're just heading to the airport now.
I've got the medical team here.
Thank you. Open the gate. Come on in.
Thank you.
Thank you so much. As a transplant nurse, it's our goal to give critically ill patients a second chance at life. I think it's important to remember that for this to happen, there is a family at the other end who's saying goodbye to someone else.
In emergency,
Looks a bit red.
resuscitation nurse Yoon suspects that bariatric patient Bruce may be suffering from sepsis, a life-threatening bacterial infection.
It's all right, mate. You just relax, okay?
Bruce can deteriorate very quickly because sepsis works very quickly on the body.
Just look at me, mate. Look at me.
He's very sick.
They're waiting for the results of his blood tests when Bruce's condition suddenly worsens.
You found? Your heart was with a funny rhythm there for a few beats. Ventricular tachycardia or VT, okay?
So Bruce is having what we call conscious VT, and so his heart's slipping into this abnormal rhythm, which is probably related to his infection that he's got.
You okay, Bruce?
With VT, ventricular tachycardia, if you have prolonged runs of this, you go into cardiac arrest.
Bruce is going downhill fast.
Do you know where you are? Where are you?
Australia Hospital.
You think you're in South Australia?
We really need to keep a close eye on Bruce at this stage.
He's worse.
Hey, Bruce. You all right?
Bruce has deteriorated. We're worried about his heart at the moment. We're worried that he'll go into cardiac arrest. So we put the defibs on. If we need to shock him, we will.
Defibrillation is a procedure that provides an electric shock to the heart. It's a last resort.
But where are you now? Hello? Hey, man. Bruce? Bruce? Just look at me, mate. Look at me.
On the other side of the country, Holly and the two surgeons have finally made it, retrieving the donor lungs. A chartered flight will get them back to Sydney for the transplant. But there's a problem.
Sometimes we do access the chest of the donor and there is something that is untoward.
A lesion was found on the donor's liver and has been sent for urgent testing.
If there's a malignancy that's found, I mean, that could have spread to other places in the body. We immunosuppress our patients afterwards. So you can imagine if you have a small lesion and then you're gonna completely immunosuppress someone, that's just gonna be like, you know, a wildfire throughout someone's body. That could mean that these organs aren't viable for transplant.
Back at St Vincent's, the ICU team has to prepare the young patient for the worst.
So even the last minute things can change. We're not happy with the quality of the lungs. Yeah. Things can change. Okay.
The retrieval team has landed in Sydney, and Holly is anxious to hear the results on the lesion test.
Hey Shona, it's Holly. Just wondering if you've heard anything regarding the frozen section? Okay.
If the patient doesn't get his transplant today, he won't survive.
There are times when you're so close to bringing home this transplant for this patient. You think you've got it all wrapped up with a bow and it just unravels in front of you.
Bruce?
In emergency, the team is closely monitoring bariatric patient Bruce as they suspect he has a life-threatening infection.
That's okay. That's just all your wires giving you all the good
You're
stuff.
attached to so many different wires at the moment.
Bruce is becoming increasingly disorientated, but it's his irregular heartbeat that is the most concerning.
With ventricular tachycardia, you know, if you have prolonged runs of this, you go into cardiac arrest.
Yeah, he's definitely got another run of it, doesn't he?
Yeah, but he's having very short episodes at the moment, so we really need to get on top of that.
Sudden heart failure is a real possibility.
I think it's probably secondary to having low magnesium, which you're normally on. Okay, actually, let's give some potassium as well. Let's give him a mini bag.
Okay. They're going to give him some IV electrolyte replacement and see if that can flip his heart rate into a more normal rhythm.
So you've started that potassium. Whoa. Just look at me, mate. Look at me.
I'm hoping just when we get this K-mag into him,
Right,
it'll
result.
settle down.
The blood test results confirm their fears.
The blood cultures have come back positive for sepsis. It's good that we found it. We just need to treat it with our antibiotics so he doesn't deteriorate any further.
With the right medication, Bruce's condition should improve.
Bruce, just going to ask you again. Do you know where you are? Which hospital are you in?
The early signs of the treatment are positive, but Bruce will still have a long recovery ahead.
He sends Bruce to intensive care, where he will be looked after closely from the nurses and the doctors up there, and make sure the antibiotics and things are working for him.
Good man, thanks, buddy.
You're all right, mate.
It's one of the nicest things when patients thank us, and we certainly get a lot from that.
I would not be alive but for the ambulance and this hospital.
Knowing that we've done our best for the patients is an amazing feeling. There is nothing better than being a nurse.
Next door to St Vincent's emergency department is the Panda unit, which treats patients with addiction and complex mental health issues. The 6-bed specialty ward is the only one of its kind in Australia.
Panda is the psychiatric and non-prescription drug and alcohol assessment unit.
You see the doctors?
It's built as a safe space for people with psychiatric disorders or substance use disorders to seek assistance.
You want some clean pajamas?
Yes.
A staggering 1 in 20 Australians has an addiction or substance abuse problem.
As a society, we see it as a failing or a downfall, but there's so many factors in someone's life that leads to them needing to use a substance. In a setting like Panda, it's so important to treat them with kindness and respect and reduce barriers when people come in and not have them feel like they're going to be judged. I'm Allie, I'm one of the nurses. My name's Allie, I'm from Nelson, a small town in Canada. I moved to Australia 2.5 years ago.
Nurse Ali has received a call from emergency.
Hi, sorry, who's the patient?
About a patient suffering abdominal pain.
You said he's French speaking?
He's being transferred to the Panda unit after revealing a history of alcohol dependency, which might be related.
Are you feeling okay right now? Yeah. So it sounds like he's come in with some quite severe abdominal pain. He sounds like he's homeless.
Do you want some coffee or tea?
It sounds like he's drinking a fair bit as well. You're in pain. Just seems quite vulnerable. He's not super great at English, so it would be really difficult to be in a healthcare setting, especially when you're in pain and you're trying to get support for whatever you're going through. And I have some pain relief for you here, okay? Great. Thanks, Mohammed. I think we fail people in society so much who use substances. The last thing they need is to feel that you're kind of maybe looking down on them or taking a moral stance on their substance use.
You can relax.
So I think as nurses, there's so many things we can do for people, making them feel like it's a safe space versus a space where there might be judgment. Are you shaky? Do you feel shaky? A little bit?
Ali organises an interpreter so they can provide the best treatment for Mohammed.
Do you mind letting Mohammed know that my name's Ali and I'm his nurse today?
Je m'appelle Ali, je suis votre infirmière aujourd'hui.
Enchanté.
Yeah.
Hi, Mohammed. Can I just ask some questions about your alcohol?
Est-ce que vous posez des questions sur votre alcool?
Je drink chaque jour une bouteille de wine. Carton, 5 litres.
I drink 5 liters of wine every day.
Okay. How old were you when you started to drink every day?
More than 10 ans.
At the age of 10, I started drinking 5 liters of wine every day.
When you hear that, it can be very shocking, but it also, I just think, gives you such a better picture of what his life might have looked like as a child and leading up to now. People don't just drink 5 liters a day for fun. They're usually coping with something.
C'est comme Isa.
Oh, sorry to hear that.
For me, I find that really sad. Thinking about someone reaching out for a coping mechanism at 10 years old and alcohol being that coping mechanism, it really just hurts your heart.
What's been happening for you recently, Mohammed?
Qu'est-ce qui vous est arrivé récemment?
Oh, j'étais craché un peu de sang.
Spitting blood. How long have you been spitting blood for?
2 jours.
2 days.
2 days.
Just try and relax your tummy a little bit more.
Détendez votre ventre.
Painful there? Have you had an injury to your chest recently?
Oui.
Can you tell me more about that?
Qu'est-ce qui s'est passé?
C'est un bagarre.
When did that happen? A month ago? Yeah. When people have injuries to their ribs, sometimes it's hard to breathe, and then sometimes you can get an infection in your pneumonia because of that.
Mohammed will be sent for an urgent CT scan to determine the cause of his abdominal pain.
A CT scan right now is crucial to finding out whether this might be an injury or some sort of underlying condition. Just got Mohammed here from Panda, just for CTPA.
To help with the language barrier, The medical imaging machine is set to speak in French.
Inspirez et retenez votre respiration. Respirez.
We're done.
Liver's fatty, isn't it? Jeez.
That's not normal.
The results show that Mohammed has signs of fatty liver disease, a condition that can progress to cirrhosis and liver failure if not treated. Mohammed will stay in the Panda unit for treatment of his acute condition, but he also has a long-term goal.
What would you like to do about the alcohol? Would you like us to help you stop?
Yeah, s'il te plaît.
Yes, please.
Yeah, okay, good. Good if you could stay in hospital with us so we can manage your alcohol withdrawal.
He's keen to go to Gorman, which is the detox unit at St. Vincent's, and just have a supported medicated withdrawal. But he's been drinking since he was 10 years old. Recovery is a lifelong process, and relapse is often part of recovery.
Bye. Nice to meet you.
I love drug and alcohol nursing.
See ya.
I think the clients are the best part of my work. To be able to sit with people and hear those life experiences and what's maybe brought people to where they might be today is quite an honor, I think, and quite a privilege.
There's your loops.
The retrieval team has landed in Sydney, and Holly is anxious for the results on the lesion.
Hey Shona, it's Holly. Just wondering if you've heard anything regarding the frozen section? Okay.
If it is malignant, the transplant won't go ahead.
Our superpower and our biggest weakness is being empathetic. I do believe that it obviously makes you a very good nurse. It's not just the clinical side that we do, it's all the little bits that stick it all together. No malignancy, okay. Awesome. Okay, that's great. No malignancy. It's a biliary adenoma.
That's really good news.
It is such a relief to know that it isn't malignant and we can go ahead today, and this is potentially the start of a really beautiful journey for this young patient.
The transplant is on. Holly's patient will go straight from the intensive care ward to the operating theatre.
For a patient pre-transplant, it's a bit like a pit stop before a Formula One. They come out from all angles, anaesthetics, surgeons, cannulas are in, art lines are in. You know, we have them prepped, locked and loaded, ready to go. Because as soon as we get the green light from our retrieving team, it's all stations go. On arriving back to St. Vincent's, I go to the magical red line at the end of the theatre corridor. Oh, yeah. And hand over the esky to our scrub team. Time to drop off the new set of lungs. That's got your cardioplegia and everything in it. They'll start implanting now.
Down, so you'll have to do.
So Holly is the scrub nurse in this instance, so she will get passed on the baton as such and take those lungs into the theatre to kick off. Obviously, surgery carries a risk. Transplant, a greater risk than some surgeries. Fingers and toes crossed that we've made it this far, and well, there's been a few hiccups. Hopefully it'll all go well today.
Just do your best with your blows.
Yep.
On duty in theatre today is another Holly. She's one of 3 nurses working alongside 4 surgeons for this complex operation.
My name's Holly and I'm a perioperative scrub scout nurse. So today we're doing a bilateral single sequential lung transplant. This patient has been on ECMO in ICU, and this lung transplant is vital right now to save his life. The organs have just arrived into the theatre, which is really exciting. So from this point on, the clock is ticking.
So I'm going to go on, and then as soon as we're happy, I want to turn off the ECMO. And
For the last 6 weeks, the ECMO machine has kept the patient alive, by taking over the function of his heart and lungs. Now they need to turn it off and transfer him onto another type of life support.
It's a really critical moment of the surgery. We're actually taking the patient off ECMO.
The patient's survival depends on this moment.
So if anything goes wrong, the case can't go ahead.
Australians love sport, which is why the waiting room of emergency is the busiest place in St Vincent's on the weekend.
I'm on right arm. We see a lot of broken bones, you know, because you've just got kids off school, we've got sporting injuries. Accidents happen all the time.
Stay nice and relaxed.
Up to 60,000 Australians are hospitalised every year for sport-related injuries. The most common are fractures.
I do feel for people who I see that have broken bones because you can just see how painful it is. There's no typical day in emergency. We're ready for whatever comes through those doors. My name is Carly and I am a registered nurse in the emergency department. I'm normally stationed out the front as a triage nurse.
46-year-old gentleman who fell off a skateboard and he's had 10 of morph with ambos and 3 of methoxy.
Carly's first weekend warrior has had a painful mishap.
Hello, Nicholas, is it? How you going? I'm Carly, one of the nurses. What have you done?
I just fell off my son's skateboard.
All right, you're right to walk over there, mate.
Nicholas believes his elbow dislocated from the fall and then popped back into place.
Lie down in there for us if you can. I'm just going to have a quick look at it. Have you ever injured this elbow before?
Not the elbow.
No. You able to straighten it?
No.
No? OK. Back in. Sorry, mate. Do you want something else with pain at the moment?
Yeah, maybe actually.
Yeah? All right.
After administering some pain relief, Carly needs to organise an X-ray to see if the elbow is still dislocated or fractured.
I used to skate when I was 15, and now my son's into skating, so he's at the park today. I was doing a few turns, it was all going fine. Of course, I fell off. Heard a big pop, came out, and then it popped and went back in, and so yeah, misadventure.
Hey, it's Carly in ED. I was just wondering if I could bring someone around for an X-ray. Oh, a legend. I'll bring him through. Thanks.
Like, I think my son was begrudgingly quite impressed by his dad's skills until I fell off.
Now, X-ray's ready for you. Do you want me to get you a wheelchair?
No, I'll walk.
Were you a good skateboarder or just a okay skateboarder?
Just to be okay.
Like kick flips and stuff, are we talking? Growing up, my brother was a really good skateboarder. Obviously, I wanted to be just like my brother, so I used to skate as well.
I used to be able to do like an ollie and a few things.
I really enjoy the patient interaction and meeting people from all walks of life, and I just love to chat to everyone as if they were my friends, so I really enjoy that part of the job. So no kick flips?
No. Look, when I was that age, they only used to mention kick flips.
Right, okay. X-ray. This is the saw part, sorry.
No, I can't turn it.
As Nicholas waits to find out his fate, another patient has wheeled in with a skate park injury. Except this one is a pro.
This afternoon I was at the skate park. My foot's gotten slipped under the deck of my scooter and it's twisted and cracked and it's severely painful.
While he waits in triage, Nicholas's X-ray results are in, and it's not good news.
Right there. So it turns out he has fractured his elbow. He's done the radial head. Sounds like he won't need any theatre at the moment, so they're just going to put him in a sling, give him some good painkillers and send him home. And he'll go and see the orthopaedic doctors next week in the clinic just to make sure it's healing and they don't have to do anything.
With the novice skateboarder on his way, Carly checks in on the pro scooter rider.
Hey, buddy, how you going?
Yeah,
I'm Carly, one of the nurses. How's your pain at the moment?
It's probably about an 8 out of 10.
You want something for it? Yeah. Can you pop your leg down for me for a second? I just want to have a quick look. Is there any pain in your foot there? All right, what about here? Sorry, here?
Oh, yeah.
He's hurt his right ankle. It may be fractured. He can't walk on it. It's very swollen. So I'm going to get an X-ray and see what injuries he has done, poor fella. Are you a good skateboarder?
I've been a pro for 13 years. I've worked at Monster Skate Park for 4.5 years and 3 tricks so far that I've got under my belt for world records.
That's hectic. It's better than the guy before. Couldn't even do a kickflip.
I could kickflip when I was 4.5.
Oh, my God, that's so good.
That's what I did today, that trick.
Is that you?
Yeah. And then my foot got caught under the deck.
Oh. Gonna go to room 2. Room 2.
Oh. Room 2.
Let's roll. I love Santa Cruz.
But the impressive move could be his last for a while.
Lift the right leg for me. Good, just up the board under there. Perfect.
In the heart and lung theatre, the surgeons are facing the riskiest part of a lung transplant, temporarily turning off the patient's life support. Now they need to swiftly transfer him onto a heart and lung bypass machine.
The bypass machine is taking over the functioning of the heart and the lungs.
Okay, excellent.
With the bypass machine now keeping the patient alive, they can begin the transplant.
The patient's native lungs are going to come out.
2 teams of surgeons will work simultaneously to get the timing exact.
They'll separate the organs and get them ready to go into the patient. The first lung has been taken out and is ready to go into the patient. The other lung has been separated.
It's pretty good.
The first healthy lung is placed in his chest.
We've got the surgical team working on getting one lung in, and we've got another part of the surgical team that are working on the other lung to get it ready.
Yep.
The new lung's in. What they'll do is connect the vessels from the donor lung up to the vessels of the patient.
That's it. You.
With the organs connected, the patient should be able to breathe on his own. The only way to find out is to switch off the bypass machine.
We've just turned the patient's heart and lungs back on. Pretty much now what they're waiting for is to see if the organs are working. We have a moment where everybody goes quiet and we just wait to see how the lungs have taken to the patient's body.
A minute has passed and there's no sign that the lungs have taken. Nurse Holly and the entire surgical team are counting the seconds, waiting for their patient's new lungs to inflate.
Half the blue's been stayed there. He'll just come and get started.
Seeing the patient's new lungs inflate and get colour back for the first time has got to be one of the best parts of the procedure.
Really happy. So the footage is just finishing, closing up now. Long day.
After 8 hours in theatre, the transplant is complete.
And we're going to get the patient ready to go back to ICU.
It's a moment of celebration for the 12-strong medical team who have worked tirelessly in theatre.
We've given the patient a new shot at life, which is amazing. I count myself very lucky every single day that I get to do this for a job.
Lift the right leg for me. Good, just up the board under there.
In emergency, a pro scooter rider is waiting to find out if a risky maneuver has broken his ankle.
It's like Tyrone's got a fracture.
Broken?
Yeah. Sorry. This young man's got a broken ankle.
Now I know why it's swelled up so far.
Yeah. So he'll go up to the physio room and get a half cast put on, and next week he'll go to the orthopaedic clinic where they'll decide what treatment he needs from there, whether it's surgery or whether it's something that can be managed at home with a full cast and some crutches. We're gonna probably go upstairs to the plaster room, I'm assuming.
Oh, good old plaster.
The break means Tyrone won't be doing anything radical for a while. But the same can't be said for Carly.
It is a pretty gory injury, but it has not put me off skating. I'll just stick to the ground and the little ramps. That's about as exciting as I'll do. That's that.
It's the end of a 12-hour shift for Carly, but before heading home, she wants to sweeten a night shift for the incoming team.
Yum-o. This is my famous salted caramel fudge, which I've been making for a fair few years. I've made a batch tonight to bring to work to give to everyone to keep up their sugar and keep them going for the shift.
Woman of many talents, this one.
Oh, yeah. Would you like some of my fudge?
I want a big bit.
We'll take two.
Thanks, Holly.
You're very welcome.
That's delicious.
Just a bit of a pick-me-up, you're welcome. Always brings a smile to people's faces. Homemade fudge. Oh, gosh, is there a small one?
Is there a big one?
Yeah. That one in the middle has got your name all over it. It's very important to spread a bit of cheer where we work because it can be such a high-impact area that can cause a lot of stress and worry. Oh, thank you so
beautiful.
much. People always come back for more. Tony?
Did you make it?
Yeah. You got a mask on?
Love it.
Maybe I'll have one myself. Delicious. I think it's been a hit. It always is a hit, though. It's my one claim to fame. My fudge.
When I was just a little child.
We have such great staff. We're all one big happy team. I love the work that I do. I love coming to work every day. Hey, oh, happy birthday, Connor. And just, yeah, helping people.
But yeah, we'll get home and hopefully get a good sleep and do it all again tonight. I am done. When patients do get better, there's no better feeling because you know that you've done your bit for them and you've helped another human being, and that's what I get out of this job.
So tired, I've just got the giggles. The greatest joy in this role, I think, is seeing when patients get back to a sense of normal. So
Get some sleep.
I will.
Enjoy.
I will. I'll get out of here to know that we have given patients on death's door another shot at life.